Hi, and welcome to the Robinson Lloyd Resiliency Group, where you will get information on therapy, on how to help students who are experiencing depression and anxiety to build their sense of self worth and grit, and the importance of using data to inform your therapeutic choices. Today, we're looking at how to write a DAP note. I'm now going to share my presentation with you. How to write a DAP note. Just a bit of background on myself. I am a Caribbean-based clinical psychologist. I am licensed in New Jersey as a drug and alcohol counselor. I am a registered psychotherapist qualifying in Ontario. And I'm also a registered qualified test user in the UK. That's a certification that allows me to test personalities that match, a particular job. And today's presentation, how to write a DAP note. Okay. At the end of the presentation, you would understand how to assess your knowledge, understand what you are listening for. And I'm gearing this particularly for beginner counselors, right? Determine what is relevant to your client's progress. Analyze what the D stands for, the A, the P, and practice, practice, practice. Okay, so for licensed drug and alcohol counselors, we have 12 competencies that include screening. We screen the clients. Just when they make that first telephone call, we have a screening process to help guide if we're even a right fit, right? The clients and the organization is a right fit. If they are a right fit, we have the intake process. We have that will include assessments, NJ-SAMS assessments, for example, other assessments to understand their history of drug and alcohol use, understand their history of trauma, understand their history of employment, history of schooling, just really understanding who is in front of us and how we could best serve them. We have patient orientation, orienting them to the company, the expectations, and of course, what they could do if they are not satisfied with services and where they could go. We have treatment planning, understanding when to do treatment planning and the best modalities that would serve the client because it's a partnership between the client and the clinician. Of course, we have the counseling piece, the importance of building rapport, the importance of integrity and trust. We have case management, we have crisis intervention, patient education, referrals. If your clients, if you have, let's say you have to go away, who do you refer your clients to? Right. So you do have to build a network of trustworthy clinicians that you feel comfortable referring your clients to, should you have to do that. And cross consultation. So that's something that we utilize in the Robinson Lloyd Resiliency Group. We have primarily an organization of a lot of consultants, right? And so I'm very, very blessed with an awesome team of consultants from psychiatrists, from, you know, um, counselors, other licensed LACs, right? Associate counselors, LCDCs, right? We have MBAs, people who are in business. It's just a whole fantastic suite of consultants, right? And so let's say that there's something that an intern needs to know that's specific to behavioral therapy. I'm not going to try to pretend as though that's my forte. I am more from the psychodynamic, motivational interviewing, and cognitive behavioral, stream of things. That's my preference. I would call on Dr. Dorothy Hantfield, and she would, gladly come to speak to one of our interns for 10 minutes and really give them insight that she would have developed, over a long period of time. So that's the benefits of interning with our company, that you're going to have access to professionals that could help you grasp something that may take, years to get because of all of the training necessary in a short period of time to help you with your clients, with your case. All right. Next, we get into listening intensely, right? So even in a virtual space, it is very important for us to understand body language, right? My age range that I work with are children 8 to 18 years old. Okay, so typically we set some ground rules that they are willing to abide by. These ground rules may include things like put your camera on because I need to be able to see your eyes. I need to see if you're crying, if you're even present, right? I need to be able to read these cues to transfer, empathy throughout this medium. All right, and tone of voice. You're listening carefully for tones of voice, and my approach is, once this therapeutic alliance is formed and it's strong, my approach is very direct, right? That's how they get instant feedback and they're able to adjust quickly and grow from that feedback. Okay, next we're going to look at the actual DAP note piece, the D for data. Typically, the DAP note should be about 5 to 7 sentences long. We're not trying to write a book about the session, right? Just the things, the pieces that will inform the goals that the client said that they wanted to achieve. And sometimes they are not aware of the goals they have to achieve because you, as a clinician, would pick up on things that are unavailable to the client, meaning, for example, in the Johari window where they are unaware of how they're coming across to others, but because they're working with you, you could help them safely address these pieces. So everything you heard from the client or observed in the session, everything relating to the parts of or relating to information that could help the clients move toward their goals, right? It's mostly objectively self-reported from the client, but there may be some subjectivity from the clinician in the data section. Right, so typically you want to have sentences like the client seemed happy as evidenced by them stating that they were happy in their emotional recall or recalling their feelings. Make sure to document interventions and safety plans in the data section. So typically in your first session, you want to assess for risks such as suicidality, homicidality, and neglect, abuse. If you're working with children, you also want to let them know that, and you would have done this in the intakes piece of things, understanding confidentiality, right? That you keep everything confidential apart from, if they express thoughts of wanting to harm someone, harm themselves, right? And you also would assess the level of suicidality. Is it just suicidal thoughts without a plan? Do they have a plan? And take the requisite risk assessments and planning in that session. Next, we'll get to the assessment piece. Now, I've observed over the past 4 years of training interns that they really, really struggle with the assessments piece as well as the planning piece. The DAP piece, they tend to understand relatively quickly. Now, with the assessment, where it's the assessment, what is the client doing for treatment, right? So let's take a pretty dire case, right, of suicidality of a student saying, look, they have thoughts of harming themselves all the time. I've, of course, in my career, come across a lot of students, a lot of children who feel that way. Okay, and so have you decided on the treatment modality and what should be done? Typically, if we're looking at self-harm, we have found the CBT school of treatments, whether it's CBT or DBT, that it's very, very helpful. The evidence-based, the testing of the sort, the testing of reality, the learning to regulate and tolerate emotional distress. How is your client making progress? With this piece, you're looking at the levels of motivation, right? So you'd know that Prochaska has a motivational model, whether it's there in the contemplative, pre-contemplative, contemplative action stage of change, and being able to document where they're at. We do have actual assessments that you could provide your clients with to test their readiness for change. What are they doing to reach their goals, right? So if you're using a CBT-based therapeutic model, you would be assigning homework to your clients every single week, right? So this homework may look like starting off with things that are as simple as to diaphragmatic breathing to help them calm and self-soothe. Or it might be keeping a mood log if you want them to be able to gain insight on how frequently their moods change. In some cases, we've had logs of productivity where students were able to rate their levels of productivity and assess what pieces or things or situations were triggering a lack of productivity. Diagnosis to be addressed. Okay, so this is a sensitive piece. Of course, not everyone is able to diagnose in this mental health field, right? So we do have psychiatrists that provide diagnosis. We also have clinical psychologists that are able to diagnose, but they're not able to prescribe medication. So we have an alliance between psychiatrists and psychologists and social workers and counselors. And it's better to have a eclectic and collaborative approach to helping clients successfully through their healing journey. And it's also when you're working with your clients, it's the approach is the preferred approach rather is a collaboration. So whether I'm working with children or with adults, it's a collaborative effort. Have I gotten this right? What would you like me to add? What would you like to work on? How would you like to proceed? How do you feel about homework? Right? And getting that understanding from day one that that's a part of the process. As much as the clinician is gifted and knowledgeable, the client also has to believe in themselves and have the requisite determination to change. Okay, utilize peer-reviewed research and theory-based evidence in the assessment section. So this is something I noticed interns do not do at all, right? Being able to refer to, for example, Erickson's psychosocial developmental stages so that you could understand what stage your clients might be at and what their struggle might be as they try to understand their worlds. You may want to also reference Young's schema approach, right, where you're trying to understand the early maladaptive schemas that were formed and that are still determining the client's choices and lifestyle and everything else, right? And so theory and basing what you're doing in theory, grounding your clinical approaches in theoretical models, it's essential, very, very essential. Finally, practice, 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 right? If babies fell down and just said, forget this walking thing, I'm just going to stay on the ground, I think none of us would be walking, right? So early clinicians, take your time, trust your process. When I did my master's in clinical psychology, part of the program, and I want to shout out Dr. Gerard Hutchinson for providing and creating that clinical masters in clinical psychology program to benefit Trinidadians. He's personally supervised and trained hundreds of Trinidad and Tobago clinicians that are now serving people across the globe, including I'm one of those clinicians, and owe a huge debt of gratitude to him, right? And when you're just starting out, you're really excited. You have all of these tools, you know how to assess people like that, but you start to realize that it's more than assessing diagnoses. It's about the human. It's about the person. Who are they? As Dr. Hutchinson would say, what's the essence of this person, and how can you get them closer and closer to fully manifesting their true selves, to manifesting their true potentials. And the journey, the process, it's difficult. It's painful at times, but it's totally worth it. And I was, going to share that I strongly recommend, as per my own master's in clinical psychology training, to get yourselves a good therapist. One that you could not only model, but you could also put yourselves through the process of receiving therapy so that you understand intimately what your clients endure when they come to you, and you could have a fresh, most humbling approach to therapy that you will not regret. Okay, so this is Tony Robinson Lloyd for the Robinson Lloyd Resiliency Group channel, presenting on how to write a DAP note. If you have any questions, comments, concerns, anything at all, reach out to me. I will get back to you within 24 hours. Our social mission is to provide up to 40 hours of RLRG, Robinson Lloyd Resiliency Group sponsored counseling to children 8 to 18 years old to support single parent families. And we're able to do that by offering interns the opportunity, master level interns, that is, opportunities to partner with our company, so that they're able to get their experience. They're able to meet our consultants and get, be exposed to a network. And this is currently we're offering it throughout New Jersey, Ontario, as well as University of the West Indies. Email me, tloyd@rlrgresilientstars.com, if you're interested in being added to our wait list of interns. Right? I think that's it for us. Thank you for listening. That's our website. And you can reach me on WhatsApp. Please state who you are and why you're reaching out to me so that I don't block you. All right. Looking forward to talking to you more. And my next presentation would be on understanding schemas and traumas, right? Early maladaptive schemas, how they are formed, and they affect the stories we tell ourselves. It's really important for us to examine the stories we tell ourselves, because these stories could keep us trapped in some very, very unhealthy patterns and unhealthy relationships. So stay tuned. The schema story would be up next.